Now, systematic desensitization is technically supposed to only apply to scenes, things that you're imagining internally, rather than actually going out into the real world and experiencing it. Though sometimes you can see sort of this linking between the imaginings and moving out into the real world. But technically, that moving out into the real world to sort of force yourself to sit in those uncomfortable, anxiety inducing situations is technically something called in vivo desensitization. In vivo just meaning in life. And so here you would experience controlled exposure to more real life situations. So if you are afraid of heights, go somewhere that is actually tall. And in this situation, it's going to be creating quite a bit more anxiety in the moment, because if we think about sort of the proper systematic desensitization, where you are thinking about being somewhere high off the ground, or even seeing an image of being high off the ground, something like that, well, that's not quite the same as being there in real life. So, we do often see higher levels of anxiety, which means that there is also a higher risk of that fleeing behavior that would actually make your fear worse, because you would then be more likely to flee again in the future. However, if you're still able to persist, if you're able to do that sort of sitting and relaxing and forcing yourself to think about the fact that you're in this scary situation and nothing bad is happening, you can reduce those levels of anxiety much, much faster. So, in fact, the sort of more intense the situation that you're in, if it's successful, then the faster you'll see the reduction of your experiences of sort of those anxiety symptoms. So this can be really, really useful. And we can kind of have a little bit of bridging the gap there with something like virtual reality nowadays, where you could technically have a program that would allow you to be in a situation that would be scary if it was real life. And because of the nature of VR, it might actually feel and look like you are there. So, a silly example is if you have a fear of spiders, but you play a video game that has spiders in it, you could technically sit there in that virtual reality space and see the spiders, interact with them. You know that you're safe because they are technically not real, but it is a little bit more immersive than just sort of that envisioning in a controlled environment. So it could be used. So a couple of slight changes or slight manipulations on how these techniques could be applied. It all really just depends on the situation and the individual and what the phobia is, as well as the person who's going through the training process or through the procedure. So our what's the word? Therapist, goodness, not something great to forget in this chapter. Our next concept, though, is still applying classical conditioning, but here, instead of, say, reducing that anxiety experience, with aversion therapy, the goal is actually to increase an anxiety experience. So, in this case, what we're usually going to be looking at is some kind of condition, some kind of situation that you want to associate with something bad, specifically because you're probably trying to stop certain undesired behaviors. So I have two examples here. One is from a figure on the side here, where we're looking at an individual who, say, has pedophilia. So they enjoy looking at children. And of course, that is not a desirable trait. So you're trying to get rid of that particular behavior. And so, in this situation, our aversion therapy would be to take those stimuli, so images with children in it, and you would pair it with some kind of aversive situation. Now, if you haven't spent a lot of time talking about operant conditioning and classical conditioning, we can get a little bit of a crash course here. I always try and remind us every time they tend to come up. But with classical conditioning, what we typically do is we start with a stimulus that naturally has some kind of response associated with it. And the terminology that we use is an unconditioned stimulus. And all that means when it's unconditioned, it's that we don't have to learn anything about it. So in this example, they're using a shock. So applying a shock is automatically going to be causing pain and will cause a stress response or an anxiety response. it hurts, and therefore you are afraid or anxious. So that happens naturally. You don't have to train somebody to feel pain from a shock. So that unconditioned stimulus is the shock, and our fear response is going to be our unconditioned response. Just the behavior that they don't have to learn to do. It happens naturally because shocks are painful. And so here, what we're going to do then is take that unconditioned stimulus, that shock, and pair it with the thing that we want to learn something bad about. So here they're pairing those images of children with a shock. And if every time they see a child, they feel that pain, eventually we're going to treat that new conditioned stimulus, images of children, we're going to associate that with shock. And so that response of fear, of pain, of anxiety, that's going to get transferred to our new learned stimulus. So eventually, seeing children will make them feel bad because seeing those images was paired with experiencing something bad like a shock. So we've learned that association, and now anytime they encounter that stimulus out in the environment, they're going to feel awful. And that would then help suppress any of their original behaviors. If we want another example, the one in the points here is if we look at somebody who has alcoholism. So somebody who drinks too much to excess where it's causing problems in their lives. And if the goal is that we want them to stop having those desires to have alcohol, we would like to associate alcohol with something bad, we can go through the same process. Except here, our aversive stimulus, that original unconditioned stimulus, is actually going to be a drug that causes nausea when mixed with alcohol. So basically, we're going to have, or I guess the drug itself is not the unconditioned stimulus. The drug is just the way that the stimulus occurs. How best to frame this? So, I guess we could say that the nausea, the feeling of being really gross when drinking, and then the sickness and vomiting that follows would be our unconditioned response. So that feeling sick is going to be part of that unconditioned stimulus because your body is naturally going to get sick when this drug kicks in, and in response you have the nausea and the vomiting that follows. That's maybe the best way to frame it. I'm not going to get you to be labeling classic or unconditioned and conditioned stimuli and responses just because that's more of a 104 thing, but just for the explanation to match it up. We'd say over here is our unconditioned stimulus would be the thing that makes us sick, so we're getting sick, and our response would be vomiting, nausea. We then want to pair that getting sick with anything related to alcohol. The idea being that if every time they see alcohol or they taste alcohol or they smell it, anything that we can associate with alcohol, if after that they end up getting sick, so every time they drink it, they're going to be vomiting, then even seeing alcohol will become this trigger of feeling nauseous, of not desiring that outcome. And so eventually you can train away that draw of the substance. So by having these repeated pairings with something aversive, something bad, we're going to end up reducing those behaviors. You're going to avoid it because you think bad things because of those pairings. And you can use this for a whole bunch of different behaviors. If you're trying to reduce the likelihood of something happening, that can definitely play a role. So another example, and this one actually does a great job of bridging the gap between this technique, our aversion therapy, and the next slide where we start talking about different ways of employing behavior modification. An example is a dog with a shock collar. So if you have one of those invisible fences, where basically anytime the dog passes the barrier of your property, wherever that fence has been set, they receive a shock. So the shock is our aversive stimulus, and eventually that environment, that location, will become our new conditioned stimulus. So they learn that in this location, they will receive a shock. And eventually they become afraid of that location. They have a fear of that location. And as a result, they will start changing their behavior. So we've learned this association where going past this point leads to a bad outcome. And that change of behavior because of our outcomes is where we get into behavior modification. And with behavior modification, we're basically applying operant conditioning. So if we keep going with our dog example, so the dog learned to link that location in the yard with getting a shock, that location makes them afraid. That's the classical conditioning. If we then say that the dog is going to do something, going to carry out a behavior to be less afraid, we would say that they stop approaching that part of the yard. We would say that they don't go there. So that bad feeling, that aversive stimulus, is going to make them avoid that behavior. And so we can actually say that that behavior is going to be it's going to be positively punished, because if they went there, they'd receive a shock. They'd feel afraid. So instead, they go elsewhere. And by going elsewhere, we get some negative reinforcement where by going elsewhere, they don't feel afraid because they know they're safe. And those terms, the positive punishment and negative reinforcement, once again, it's something that if you took 104 and talked about operant conditioning, you already know these terms. But for those who haven't, I'm just going to break it down very basically. Not so much to the point that you need to be able to label things as positive and negative reinforcement and punishment, but just so you know what I'm talking about. But the idea is that if anything is having sort of this reinforcement component, if I say that something is being reinforced or I'm delivering a reinforcer, we're talking about something that's going to be increasing the likelihood of engaging a behavior. So we can talk about things like giving a dog a treat when they do a trick correctly. That would be positive reinforcement. If you praise a child for getting a good score on a test, that's also positive reinforcement. But punishment, if we talk about things being punishing or we have a punisher, punishment is all about decreasing the likelihood of doing an action. So if we have a child who's misbehaving and the parent yells at them or scolds them, that would be positive punishment. So by being scolded, you are now less likely to misbehave in the future. Or something like timeout. Timeout, where you are sort of forced to do something really boring. That's an awful scenario. So you are now going to be less likely to do the behavior that got you in timeout. That's technically negative punishment. So what does the negative and positive mean? What is that adding to this? Positive just means that we're adding something to the scenario, and negative just means that we're taking something away. And I like to simplify it to the terms of reinforcement is when the situation is good, and if a behavior leads to some good situation, some good occurrence, then you are more likely to do that behavior again. And that can happen if you add something good, but it can also happen if you take away something bad. So praise or food, if you do a trick right or if you do a good behavior, that's positive reinforcement because we're giving you something good. You did the right behavior and we want you to do it more. But if we take something bad away, that's also a better situation. So I always use the example of if you have a headache and you take a pain reliever, that is going to cause the pain to stop. So less pain is a good situation. So now you're more likely to have pain medication the next time you have a headache. So that would be negative reinforcement. We took something bad away. So both of those are examples of an overall good situation and an increase in the behavior. So if we look at the same logic with punishment, we're saying that it's an overall bad situation and you are going to be less likely to do the behavior. So positive punishment means you're adding something bad. You are scolding or yelling, or even something like spanking would fall under positive punishment. Whereas if we take away something good, so grounding or timeout, You are taking away something good, which means that the situation is worse overall. So if by acting out, a child is grounded and doesn't get to play video games, they're now losing out on something they enjoyed. So that is worse overall, and it might make them less likely to behave poorly in the future. So that's our basic logic. Reinforcement is more of a behavior, punishment is less. Positive, add something, negative, take something away. And the easiest way to think of it is the situation good or is the situation bad? And how does that change our behavior? Good stuff makes us do it more, bad stuff makes us do it less. So, all of that to say that if our dog is avoiding that place that makes them afraid, they're doing a behavior where they feel happier, less anxious, we are now seeing that negative reinforcement. We took away their fear and they're more likely to go somewhere else. So, they'll go to the places in the yard that don't cause a shock. So, that's the application here. We can also use this for changing behavior in a ton of different ways. And technically, all the examples that I used illustrate reinforcement versus punishment are all ways that we can shape behavior. A lot of the literature ties back to children because that's where it's been most widely studied. However, it can be applied in a lot of ways. So things like training pets is a great example. So when your dog does the action that you ask for, you tell them to sit and they sit, and you give them a treat, they're more likely to sit the next time you tell them to. That would be positive reinforcement, and that's a method of behavior modification. So you've changed your dog's behavior. You can use all sorts of different types of these sort of operant techniques, things all the way from shaping, where you are going to sort of nudge their behavior in the direction that you want them to go. Basically, before your dog sits on command, you have to sort of work them up to that. Or maybe sometimes you have to push them into a sitting position. You get them used to what the word sit means and push their butt down, and eventually they will sit without you having to push. We would say that you have shaped their behavior. You've changed their behavior. We can also have extinction. So that's kind of what we were doing with our systematic desensitization. So an extinction of a fear response, you're forcing that to go away. Technically, extinction can come from either classical or operant conditioning, but that's more than what we really need. We can also reduce behaviors, so things like positive and negative punishment can be used, though there is always a caveat with that. As time has gone on and as our understanding of the outcomes of different types of punishment have expanded, we've actually started to realize just how harmful positive punishment in particular can be. Punishment overall is fairly problematic. To illustrate that, let's go with a child who's acting out. So we have a child who draws on the walls and the parent yells at them. So that's a bad, you're introducing an aversive stimulus. And so that can cause harm. So that can make the child afraid. That can cause all sorts of long-term effects. So that's not great. But even if they're punished in the terms of negative punishment, you ground them or you take away their crayons. Okay, so that's telling them not to draw on the walls, but it isn't telling them what they should be doing instead. So what we actually find is more effective and a lot less harmful is to use something like differential reinforcement of other behaviors, which is basically to say, okay, we tell the child that they're not supposed to draw on the walls. Instead, we're going to get them to come and color in a coloring book, and we're going to give them praise for their coloring abilities. So now we're redirecting that behavior and giving them positive reinforcement for the thing we would like them to do instead. Something like that is far more effective. And so what they usually end up just sort of coming to is we avoid positive punishment unless there is an extreme situation, which we'll talk about momentarily. You may find that negative punishment can be effective. Taking away something good is a lot better than introducing something bad. But that should always be paired with some kind of reinforcement if at all possible. We'd like to give them some other behavior they should be doing. We'd like to try and encourage their behavior in a particular direction. Now, back to why positive punishment can be so problematic. There's all sorts of different things. Things like if a child sees someone engage in positive punishment, they're more likely to copy it. Also, out in the real world, those who use positive punishment and find that it works, that is technically negatively reinforcing for them. So if you think about it, a child is throwing a temper tantrum, so their parents yell at them. So the parent is using positive punishment, introducing yelling to make the child stop. But if the child stops crying, well, we've now removed something that was bad. So the parents are now more likely to yell in the future to stop that bad stimulus. So now, negative reinforcement. So if positive punishment works for the person, they're more likely to use it again. And there's all sorts of other things, but that's more of a learning class, more of a 104 thing. So I won't go much further. Um, I did mention that there are cases where you can technically get approval, and those are often going to be in situations where none of the other alternatives work, and this might be the only way that you can stop some situation that would cause harm. So if we have a situation where, say, a child is engaging in really dangerous behavior, so you have a child who's climbed up onto the railing of a balcony, and the only way to keep them from continuing to walk in that precarious and dangerous position is to scream at them or to go and grab them. In that case, we'd say that the positive punishment is probably the only way that you could quickly change that behavior to reduce the risk of them falling. So in sort of controlled situations for experiments and stuff like that, in order to have ethical approval, you'd have to show that this is the only approach that can improve this situation. This is the only option. We've tried everything else. And you'd absolutely need to have all sorts of approval from the individuals receiving that punishment, or if it's children, from their guardians. So it gets very, very muddy and needing lots and lots of ethical considerations and approvals to apply positive punishment. And the reasons that I listed for why it's so dangerous and not so helpful are part of why that's the case. So yeah, only really used in very extreme situations. All right, what else? We have, for additional operant stuff, token economies. This is actually just an extension of that idea of positive reinforcement, but kind of introducing a new take, which is the idea of primary and secondary reinforcers. Again, a concept beyond what we need, but it helps understand the situation, so I'm going to use them. But the idea being that a positive reinforcer, or sorry, a primary reinforcer, is going to be something that on its own is reinforcing. It is something that is good. So food is a primary reinforcer. You don't have to teach a kid that food is good. Getting food is a benefit all of itself. So anything that is naturally beneficial, that is naturally good, would be a primary reinforcer. But we sometimes learn about things that on their own aren't good, but we can interpret them as good through learning. So this would be something like money. Money on its own, if you hand a small child a coin, that means nothing to them. But if they've learned that money can be used to buy things like candy, well, now that money is desirable, not because of its own qualities, but because it can get you other primary reinforcers. So money becomes a secondary reinforcer because we had to learn about it. Same thing with like gold stars on your homework. A gold star on its own is just a sticker, but if this goes along with the idea that you did a great job, praise and positive things that make you feel good, the star is now something that is good because of that. And you'd be able to go home and say, show your parents, and they'd give you praise too. So things that we've had to learn about would count as secondary. And the whole reason why I'm mentioning that is because we're going to be looking at how you can use things that themselves are not reinforcing, but can lead to that situation of positive reinforcement. So here we'd use something like money or some other token as a way to give positive reinforcement. And this is often used in controlled environments, like something like a group home or a facility where people are learning to be able to support themselves out in the real world. And so they can establish these systems or economies where there are a certain set of different behaviors. And anytime you do one of those desired behaviors, you are going to receive a certain number of points or a certain number of tokens. And you can accumulate these tokens, and at some point, you can decide to cash them in. You can exchange them for some kind of tangible primary reinforcer. So I'm going to trade in my tokens and I'm going to get cake for dinner. Or I'm going to trade these in and I'm going to get extra time playing video games. So you're able to exchange your tokens for something that you want. And so this gives us that motivation to do more and more of these good behaviors, things that would be useful for them in their lives. And so we find this increase in desired behaviors. And we can also start tying that with things like praise. So when you are getting your token, they would say, "Great job, here's your token." And then all of a sudden, doing those actions becomes reinforcing because, hey, I got praise and others are watching me and praising me too, maybe. And you also start feeling good about yourself. So self pride can be self reinforcement. And by adding all those extra types of good feelings, we get to the point where, hey, in the real world where there aren't people to hand out tokens, you still have that internal reinforcement process. And you've learned to do these behaviors. They might even become habits where you're more and more likely to keep doing them in the future, which is exactly the goal of these token economies. So a whole lot of extra information for a very specific type of treatment strategy, but it can be very, very effective when applied in the right way. This question or this slide, this is something I already did with our earlier discussion about positive and negative punishment and reinforcement. This is the why not punishment, or specifically what are the cases when it could be applied. And you really do want to find alternatives whenever necessary. And you would have very controlled conditions if it was being used. So again, ethical considerations and so on and so forth. But I don't want to spend too much time on that because I already did it as a tangent. And then our last slide for this section is all about modeling, which is another one of those topics that we've brought up before, where we've mentioned modeling or social learning or vicarious conditioning. All of those apply to the same concept. But this is basically saying that we can watch others engage in certain types of actions, and we can model or shape our behaviors based on those observations that we've made. So this is basically how our social norms work. We watched people act the way they're supposed to act out in public. We, with our example of social norms for how to ride an elevator, we've gotten into an elevator with a parent and we watched the parent stand in a spot and face a certain way and do certain things. And by observing that behavior, we can then copy it for ourselves. So that individual would be a model and we can copy their actions if we want to get the same outcomes. So that's really, really useful. And we do that a lot throughout our lives. Anytime we encounter a new situation, something we don't have experience with, we usually look to others and see what they're doing to try and figure out what we should be doing too. And this can be really useful for a whole bunch of ways. We can tie it into some of our earlier learned concepts. Things like increased self-efficacy, which is basically saying that if you watch somebody else do a certain action, and especially if it's like they're trying to solve a problem or do a task, and they successfully solve that problem or successfully complete that task, you're like, hey, they just did that. I could definitely do that too. So you feel more like you have the ability to succeed. And as we've seen, feeling like you can do it is definitely helpful in helping you actually do it. So you can find that those boosts, those feelings of watching and then copying and feeling like it's possible, can improve your performance in certain environments. So definitely a process here. And we link this to that idea of sort of our behaviorist type concepts because if we go with that vicarious conditioning frame, we're saying that maybe you watch somebody do the behavior and their outcome is good, so they're more likely to do the behavior, but also so are you. And it can work the other way too, where if somebody does a behavior and the outcome is bad, you're less likely to do that behavior because you don't want that bad outcome either. So yeah, lots of ways we can make links between all of these topics.